In this video, I'm going to share with you my personal opinions on my favorite medicines to manage common MS symptoms. Tune in, because I'm going to start right now. Learn about MS with me, Boster. I started this channel to help my own MS clinic patients learn between visits. And it's my hope that through these videos, I can help you learn too. I use easy to understand language to bring you accurate and approachable multiple sclerosis education. So if you're impacted by MS and you want to up your game, subscribe to the channel right now. And please ring that notifications bell so that you're alerted to all of my upcoming educational content. I divide the management of multiple sclerosis into three separate categories. The first is managing acute MS attacks. The second is disease modification, slowing the disease down. The third is managing chronic symptoms. Now allow me to explain. When someone with multiple sclerosis suffers a clinical attack, we give them medicines to help them recover. Unfortunately, they don't always fully recover, and they can be left with a residual deficit. I'll use an example of an attack that results in left leg burning. In this example, we give the person steroids, and they recover 80%. They're left with a residual burning sensation in their leg, which now becomes a chronic and bothersome symptom. Symptoms in MS can erode the quality of our lives. They can impact our daily functioning, our performance at work, and our ability to enjoy ourselves. And we must, if we're going to do the best job possible, address chronic symptoms. Now, I have made several videos on behavioral measures to improve a myriad of symptoms, but what I have not done very much is talk about medicines. I'm an allopathic doctor, an MD, and I use lotions and potions to help people feel better. I have to throw out a couple disclaimers. In this video, I'm going to be talking to you about my personal opinions on my favorite medicines to manage common MS symptoms. I am not providing you with medical advice. This video is intended to be a form of medical education. I'm not talking about how well the drugs work and the risks associated with them or the monitoring that's necessary for them or anything like that. That's a conversation that you have to have with your medical provider, and this video certainly doesn't replace that. So let's get started. The first symptom I wish to tackle is spasticity, which manifests clinically as limbs that are very hard to bend, spasms and bouncing of limbs, and painful cramps. Now, in order to properly manage spasticity, we have to have a multimodal approach. We do multiple things at once. Exercise, stretching, heating the limbs, staying adequately hydrated, all of these things are critically important, and I've talked about them in other videos. Today, I want to focus on medications. And my favorite medicine when managing mild spasticity is oral baclofen. Oral baclofen is one of many antispasmodics, and it's my favorite for a couple reasons. Reason number one, I find it to be the least sedating of all of those medications. This is a medicine that oftentimes people have to take during the workday, and I can't have them feeling groggy and sleepy. Number two, it's easy to titrate. I can start people at 5 milligrams a day, which is a pretty low dose, and I can slowly, over multiple weeks, increase them. And I tend to go up on baclofen very slowly, like 5 milligrams a day for a week, and then 5 milligrams twice a day for a week, and so on and so forth, until we get up to a therapeutic level that works for that patient. Baclofen can be taken to mirror the needs of the patient, and so if they only need it at night, they can take it at night. Some of my patients actually have to take baclofen 4 times a day, right when they wake up, around lunchtime, around dinner time, and then before bed. And this is a medicine with which we can do that, and so I find that very helpful. Now let's turn our attention to depression. Depression is exceedingly common in multiple sclerosis. It's actually twice as likely to occur in people with MS as compared to the general population. On this YouTube channel, I have multiple videos talking about different ways, tricks, and tips to optimize people with depression. And if you haven't seen those, I'd recommend that you check them out. When it comes to medication management for depression, I like Wellbutrin the best. It's my favorite antidepressant, and I want to explain why. Number one, it's not sedating. Many of the other antidepressants I find can cause some degree of sedation, which is just not very tolerated in people that are trying to live active lives. Number two, it does not cause weight gain. Many of the antidepressants can. And people with MS are at risk of having difficulties maintaining their weight, and so I don't want to give them a medicine which could contribute to that. In fact, sometimes Wellbutrin is known to curb your appetite, and so in some ways it can kind of help with weight management. Number 3, it can be used to help decrease the desire to smoke cigarettes. As many of you who follow my channel know, smoking is a no-no in the setting of MS. And using Wellbutrin can actually be very helpful in moving towards quitting smoking. Number 4, Wellbutrin can be taken with an extended release dosing, so you only have to take it in the morning. And that's kind of lovely, because that way you're not being asked to remember to take it multiple times a day. Number 5, Wellbutrin does not worsen sexual function. It's my opinion that if you're depressed and I give you an antidepressant which makes you have trouble with sex, you're going to be more depressed. And so Wellbutrin is one of the only antidepressants that doesn't tend to worsen sexual function. Now, Wellbutrin is not for everyone. If you have a seizure disorder, Wellbutrin is a no-no. And sometimes Wellbutrin can worsen anxiety. And so obviously, this is not a medicine for everyone. But if given the opportunity, this is my go-to medicine when treating depression in multiple sclerosis. Heat sensitivity and motor fatigue are very, very problematic for many people with multiple sclerosis. It's kind of a unique symptom in the setting of MS, where someone starts walking, and as their body heats up from the exercise, they short circuit, and their legs become weak and they can't keep going. Or in the setting of August in Ohio, when it's really hot outside, they have cognitive and pathologic fatigue to the extent where they really can't function. Heat sensitivity is a problem. And there's one medicine which has been FDA approved to help with heat sensitivity, and I really like it. It's called Ampyra, or 4-aminopyridine. Ampyra is a twice-a-day medicine, which only seems to help about a third to maybe a half of people with MS. Now, we're not smart enough to figure out ahead of time which people with MS will respond and which people don't. And so oftentimes I have to put someone on it for about a month, taken twice a day, before we can really determine if it helps or not. I'll share with you anecdotally that in my experience using Ampyra, I only see one of 2 responses. After a month on drug, I either see what I call a Lazarus effect, which is a, wow, this is really awesome, or I see an eh. And if I get an eh, then it didn't really work, and we have to take the person off of this. Now, Ampyra is not okay for everyone. And if you have problems with kidney function, or if you have a known seizure disorder, this drug is a no-no. What about neurogenic bladder? I'm talking about urinary urgency, where you have to sprint to the bathroom for fear that you won't make it in time. And urinary frequency, where you feel like you're getting up and going way more often than you need to, and maybe sometimes getting up multiple times at night. And urinary accidents. So what do we do about that? My favorite medicine to manage this is a drug called Santura. Santura XL is a once-a-day pill, and that's awesome, so you're not being asked to take pills multiple times a day. And the reason that I like Santura, as opposed to other common medicines like ditropan and detrol, is because of cognition. This class of medication risks clouding cognition and creating cog fog, which is something that many people with MS struggle with, and we don't want to give a medicine that worsens it. The reason that Santura is my favorite is it has the least number of cognitive side effects. Now, staying on the theme of bladder, what about urinary retention? I'm talking about where you need to go and you go to the toilet and nothing happens. And you sit there and strain and push on your bladder and maybe a little comes out. You finish going to the bathroom and as soon as you step away, you got to go again. Urinary hesitancy and other symptoms of retention are very common in multiple sclerosis. And so from a pharmacologic standpoint, I have great success using Flomax. Now, Flomax was invented to help men with enlarged prostates because it can open up the bladder neck and allow them to get the urine out. In men and women with multiple sclerosis, Flomax can have an excellent benefit in opening up the bladder neck to allow them to empty urine all the way. It's a medicine that I oftentimes ask people to take before bed because it can cause a side effect of lightheadedness, and so if you're asleep, then you're not bothered by that. The other option in managing bad urinary retention is a urinary catheter, which actually is an awesome option, but many people are reluctant to go there right away. And so I like to start with Flomax. Neuropathic pain is unfortunately all too common in the setting of multiple sclerosis. It's one of these invisible symptoms which can literally erode the quality of someone's life. And we use off-label medicines that stabilize cell membranes. Typically, we're using anti-seizure medicines and antidepressants for their effects on pain. Now, there's no one-size-fits-all, but if I had to pick one medicine that I like the best, it would probably be gabapentin or Neurontin. Gabapentin was invented to treat seizures, and it stabilizes cell membranes in the brain to stop seizures. It can also stabilize cell membranes to decrease abnormal firing that causes neuropathic pain, and it can be quite successful. Why do I like Neurontin? Well, number one, it comes in lots of different doses. So I can use a very small amount if I need it, or I can use real big pills and use a large amount if I need it. And I have a lot of room to titrate. Number two, it's well tolerated by most people. Most of the patients that I put on Neurontin don't suffer from a lot of side effects, and so I really like that, because the goal of giving them the medicine is to make them more functional, not sleepy and tired and dizzy, which would be in counterpoint to that. I also like Neurontin because I can dose it as frequently as I need to. I can give it just before bed or just upon waking, or up to 4 times a day. Now, Neurontin's not the only medicine, and just to share a little bit, there are many times where I might reach for another one. For example, if I have a patient that's suffering from neuropathic pain and depression, I really like using a medicine called Cymbalta because it can treat both. If I have someone that has really bad insomnia and they're having neuropathic pain, I like to use a tricyclic antidepressant such as Elavil or Pamelor because it's somewhat sedating and it can help them fall asleep at night. In patients with neuropathic pain that are struggling with weight gain, I sometimes reach for a medicine called Topamax because one of the side effects of Topamax is it can cause weight loss. My point here is that treating neuropathic pain pharmacologically is very involved, and we have to consider the whole human being. But if I was to reach for one medicine, it would probably be Neurontin. What about erectile dysfunction? Unfortunately, some men with MS can suffer from erectile dysfunction, and given that sex is a massively important aspect in quality of life, if a man is bothered by that, I want to give them a little blue after dinner mint to improve Friday night. I'm talking about Viagra. Now, there are many medicines in this class, and they're outstanding. To be blunt, I have the most experience using Viagra, and I find that it can be very, very helpful. I also like the fact that nowadays there's generic Viagra, and so sometimes we can get it at a lower cost point. Many people with MS suffer from constipation. This is a terrible symptom, and we don't talk about it enough. I have a video on this channel talking about many different ways of managing constipation, and I do not recommend starting with medicines only, but that's what this video is about. Now, what's my fave? Miralax. Now, I don't start with Miralax. I oftentimes will have people use suppositories and other things, but if we're really struggling, Miralax is my go-to. It's a liquid that doesn't have a taste, and I like to recommend that patients mix a half a cap in with their morning coffee. And I have them take a half a cap or a full cap every morning until they can start to become regular. Now, a tip about Miralax: you can't keep taking it. If you continually take Miralax without stopping, you're going to have what my wife refers to as mud butt. Fatigue is a monster in multiple sclerosis. It is the most common symptom of MS, and one of the 2 major reasons that people with multiple sclerosis leave the workforce. Fatigue presents in many different ways. This can be a pathologic fatigue where you literally are trying desperately to stay awake. It can also be a cognitive fatigue, making it harder to process and think as the day goes on. I have many videos on tricks and tips to improve fatigue, and today I want to talk about my favorite medicine, Provigil. It's not a traditional stimulant, but it can be remarkable in its ability to help people with MS stay awake and to stay thinking clearly. It doesn't have the same dependence and the same tolerance that I see with traditional stimulants like Adderall. And it can be used with a half a pill in the morning. If necessary, it can be redosed around noon. Now, Provigil, like all medicines, has side effects, and we have to worry about insomnia and anxiety and high blood pressure. But Provigil has helped many of my patients continue to stay working and continue to stay active. One last tip about Provigil: I find that if you take a drug holiday 1 day or 2 days a week, it tends to work better. What about insomnia? I'll share with you my own personal opinion that I don't like sleeper agents. I sort of think it's like Bugs Bunny coming up and hitting you on the head with a hammer. And that can cause a lot of different problems. One of my biggest gripes with sleeper agents is that patients literally become dependent upon them. So after you've taken them for a while, if you don't take them, it's really hard to regulate your sleep. I also find that sometimes people wake up groggy when I give them a sleeper agent, and so I don't like that. What do I like? Melatonin. Melatonin is a natural substance. It's actually the way your brain tells you that it's time to go night-night. I find that taking a decent dose of melatonin right before bed can be very helpful, along with behavioral measures, in trying to induce a natural and healthy form of sleep. There you have it, my own personal opinions about my favorite medicines to manage common MS symptoms. Again, we don't only take care of people with a pill. It requires a multiple modality approach in order to be successful in managing chronic symptoms. I hope that this video gave you some insights into how we might apply pharmacology as one of the many tools to improve function, optimize people's lives, and make them the most awesome version of them possible. Thanks for learning about MS with me, Aaron Boster. And until my next video, take care.